Thanks, Tracy. It's so nice to see everyone in person. This is a delight. I'm going to be introducing our keynote speaker in a moment, but I wanted to say a few remarks this morning or this afternoon to kick us off and to throw out a number for you, which is 384. That is the number of Rhode Islanders that died of a drug overdose last year. It's more than one every single day in our small state. Across the country, more than 250 people die of a preventable drug overdose each and every day. And we gather here and engage in this work because we know that these tragedies are preventable, right? That overdose death is preventable and that there are solutions. And that's what we're focused on this weekend. Yet we've been dealing with this crisis for many years now, and there is seemingly no end in sight. The COVID pandemic, as Tracy mentioned, has exacerbated the overdose epidemic and taken mortality rates to unprecedented and unacceptable heights. And now with an unregulated drug supply becoming more contaminated with fentanyl and affecting more substances, an extraordinary number of people are at risk. So there is a lot of understandable fear out there in the world right now. And the problem with fear is that that can lead sometimes to steer our drug policy in a negative direction. It can lead to criminalization, to stigma, and only entrench and reinforce racist policies and racial inequities. We face additional challenges brought on by the pandemic, which we've all gone through: isolation, increases in stress, an affordable housing crisis here in Rhode Island, unemployment, and a shortage of injectable naloxone. So now more than ever, we need new ideas and approaches, and that's where an event like the Hackathon comes in. Innovative and novel ways to address overdose and move us away from these fear-based approaches and towards hope, which is the motto of our small state. So as much as things are bad right now, we also have much to celebrate. And I do think this is a unique time in American drug policy where we're making good progress. And Rhode Island is a national leader on this front. We are the first jurisdiction to implement a statewide system for medications for opioid use disorder in our correctional system. We're one of the first states to legalize the distribution and use of fentanyl test strips and other drug checking equipment. And we are the first state to authorize a harm reduction center, what's known as supervised consumption sites. So we are leading the nation, and there is a real opportunity here now for us to move American drug policy into the future, a future focused on health, on reducing harm and care and compassion. And your work, our work at the Hackathon can be part of this momentum. The Hackathon, I love this concept. It's kind of radical because it democratizes the process of finding solutions. Anyone can participate and crucially are encouraged to work together to find solutions to a problem. And it allows us to look at problems differently by engaging people from different backgrounds and perspectives who hold different viewpoints than we do. And this is important because the overdose crisis affects every corner of America, so we need solutions from many different stakeholders. But it must involve people who use drugs. It must involve people with lived experience and others who are directly affected. So the solutions here today, my hope is that they should not be limited to the ivory tower or the halls of state houses or congressional buildings. They're really going to come from the ground up this weekend. So the hackathon will last a few days, as Tracy mentioned, but I hope your enthusiasm and passion for addressing this crisis will continue well beyond, whether you live in Rhode Island or are from another state. We have people joining this weekend from across the country. If this is your first foray into drug policy and overdose solutions, there's plenty of harm reduction coalitions, government boards and commissions, and drug policy organizations that need your participation and support. There is legislation to lobby for, to testify for, and to protest for. And there are people in our state and across the US who need housing, who need resources, who need naloxone, and who need other supplies and care. And there are millions of people affected by the overdose crisis and that need that compassion and support. So that's our goal this weekend. And as a judge on Sunday, I'm looking forward to seeing some of the incredible solutions and innovative approaches to tackle what is an incredibly complex and unprecedented problem. So to help frame our thinking around this and to talk about some national efforts, it's my pleasure now to introduce Dr. Kim Soo. She is a medical director of the National Harm Reduction Coalition, where she provides national training and technical assistance to improve the health and well-being of people who use drugs. She's a practicing board-certified addiction medicine internist, anthropologist, and instructor in the program in addiction medicine at the Yale School of Medicine. She is a graduate of the Harvard Medical School's Social Science MD PhD program, which is where I met her, and completed her medical training at Massachusetts General Hospital. She's published a book, which I recommend you pick up and read, called Getting Wrecked: Women, Incarceration, and the American Opioid Crisis, which uses a medical anthropology lens to examine the intersection of the US prison system, addiction policy, mental health, and treatment involving women in Massachusetts. And she has worked in diverse clinical environments, including syringe service programs, methadone clinics, the Rikers Island jail prison system in New York City, and in response to the COVID pandemic as well. And I'm very honored to consider her one of my colleagues and friends. So with that, I'd like to welcome you all and bring up Dr. Kim Soo to give the keynote this afternoon. Thanks so much.